October is Breast Cancer Awareness Month, and today doctors, medical professionals, and members of Congress gathered at Meredith College in Raleigh.
Yeah, they discussed how they say recent cuts at the National Institutes of Health are impacting breast cancer research. Sean Coffey is at Meredith now with more.
Cancer experts say they're concerned that any interruption in funding could have ripple effects down the road, while there are also concerns today about possible brain drain and divestment from places like Research Triangle Park.
We're going to lose the talent, and when you lose the talent, you lose the ability to attract other companies.
For Congresswoman Deborah Ross, federal cuts at the National Institutes of Health and to local research grants aren't just bad for health care in North Carolina, they're bad for business.
Democrats and Republicans have been attracting these amazing biological research facilities, unbelievable pharma all over this area. This is good for the people of North Carolina, the country, and the world, and it's great for our economy.
On Friday, Ross hosted a shadow hearing alongside New Mexico Congresswoman Teresa Leger Fernandez, a breast cancer survivor, to raise awareness about breast cancer research and how that work is being impacted by recent cuts.
I do not understand how anybody could make life-saving care for women around breast cancer or any of the other cancers that uniquely affect women. That should not be a partisan issue.
For local oncologists, including Dr. Carrie Anders with the Duke Cancer Institute, there are concerns about how medical innovation could be impacted long-term.
I started my training in medical oncology in 2005, and in 20 years, the number of drugs that have been FDA approved is just astronomical. Even in breast medical oncology, we've had several even just in the past 6 months. So we don't want to see that slow down.
Amid the backdrop of Breast Cancer Awareness Month, doctors like Anders say it's a moment to reflect on the progress being made and how work in places like the Research Triangle fuels it.
But we want to keep that momentum going. We want to keep seeing those discoveries in the laboratory, keep translating those discoveries to clinical trials, and then ultimately FDA-approved agents that we can give our patients in clinic every day.
The White House has pointed to what they call a lack of accountability in NIH and research grant funding in describing their reasons for making these cuts. In one executive order, President Trump said all federal funding should improve American lives and advance the interests of the American people. In Raleigh, Sean Coffey, ABC 11, Eyewitness News.